Megan Fox accused of getting these procedures. Recently, Megan was on the Call Her Daddy podcast and she revealed procedures that she's had, and she also gatekeeped one that she didn't have, and I think I know what it is. Stay tuned.
Here's things I haven't done that I have been accused of doing.
Okay.
And then I'll confirm the things I have done.
Okay.
I've never had a facelift of any kind. So no mid facelift, no like lateral brow lift, although I would like one, or no regular brow lift. I've never done threads. I have researched them. That's not because of some moral thing. I just don't really believe they work. And I'm also afraid that they would interfere when I do need to have a facelift.
So first, she says she hasn't had a facelift. It's really impossible for me to know unless I look to see the typical scars for a facelift, but I do believe her. She's so young. Her face looks incredible. Even though some people do have facelifts when they're young, it doesn't look at all like she needs it. She's got beautiful skin, great facial shape and contour. So I do believe that she has not had a facelift. The second procedure she said she has not had, first she said was a lateral brow, which is just trying to, almost like people are doing those fox eyes where they try to pull up the outer brow, or a full brow where you lift the entire eyebrow up. Again, I would have to look closely in her scalp to see if she has the typical scars for what we call an endoscopic facelift, where we use a scope to elevate the forehead and pull the eyebrows up. But again, she's so young, she doesn't have the typical ptosis or drooping of the eyebrows that we would see. And so I do believe that she probably has not had that one done either. The third one she said she has not had were contour threads. I love that she said that she has researched that one. That is so important, and it's great to hear people doing their homework. There are so many videos on social media, and I've talked about this in the past. I'm not a huge fan of contour threads for several reasons. One, medical professionals who really don't know what they're doing are doing them, and they're placing them too shallow underneath the skin, and it can cause puckering that looks horrible in the skin if it's too shallow. The second thing is they dissolve over time, so they don't hold the face up for very long, and so you have to keep doing them every 6 months to a year. And as she alluded to, she's nervous that in the future she knows as she ages that she probably will want a facelift. If you keep doing threads over and over and over, it can cause some severe scarring in the face to the point when the surgeon goes to do the facelift, it can interfere with their ability to do a good job.
I've never had this done. What is this?
Buccal fat.
Buccal fat.
Buccal fat.
I've never had that done. I'll never have any fat removed. I'm a very lean person that doesn't have enough body fat or fat in my face, so I will only ever put fat in. I will never be taking fat out, which leads me to I've never had any liposuction or body contouring or anything like that.
What is buccal fat? So inside of the cheeks, for some people who have very rounded cheeks, we have some fat pads called buccal fat, and you can go inside the mouth. I'm sure you've seen these videos on social media. We'll show you one here where you go inside the mouth to take out the fat, and it causes narrowing to the cheeks. The problem with buccal fat removal is so many people have too much fat taken out, and it causes this sunken in appearance. She's got really beautiful shape and contour to her face and her cheeks, and so I agree, it does not look like she's had buccal fat removed. The next one she said she has not had is liposuction. Again, I commend her for knowing her body and knowing the risks of doing liposuction when it's not indicated. In patients who are really lean, liposuction can cause puckering and a really awful looking scarred contour to the areas that you liposuction if there's not a lot of fat. So because she's lean and she knows she's lean, I do love that she's researched it, and I do believe her. Now, she did show a picture on her Instagram today. I saw it showing her belly. We'll put that up here for you to see. And it does indeed look like she has a very smooth contour to her abdomen. And so it doesn't look like she's had liposuction, as everything looks beautifully shaped. And actually, she looks like she's got a little bit of volume there, which I think looks great.
I've never had
butt implants.
I mean, I would be so flattered if somebody thought I had a BBL.
Megan.
If I could, I would. I don't have the extra body fat. I would get it done if I could. And that surgery is such a hard one to recover from. It's so insane. It's basically 3 months you have to lay flat on your face.
I could never be me.
You're bruised for an eternity. I would be like, if I'm going to survive that surgery, you're going to give me an ass that's an anomaly. When in the future you can take donated fat from people, I will be doing that.
Again, playing off of her previous comment that she's never had lipo, totally believe her. She's too lean. There's definitely not enough fat on her body to get enough to augment the gluteal area. A lot of people will alternatively put Sculptra into the gluteal area. Sculptra is a product called poly-L-lactic acid, and that can actually stimulate collagen production in the gluteal area. The problem with that product is you need 20 vials of it, and you need to do that on 3 3 different occasions to really augment the gluteal area. So you end up paying 15 to 20 grand just for the product. And so in my opinion, it's not worth it, but it does work. She also alluded to that you have to lay on your stomach to recover from a BBL. And actually, it's not true. I sat in on a conference once, a BBL conference at our meetings, our big meetings, and some of the big BBL docs were talking, and they talked about how they would have patients recover on their stomachs versus their backs, and they saw no change in contour if they allowed patients to sleep on their backs. So when I do BBLs, I do allow people to sleep on their back and they can shift side to side. I just don't want them ever sitting directly on their gluteal area because that can affect the contour. Now listen, we have all seen these crazy videos with women with these huge bottoms who've probably had multiple BBLs. Megan, please don't do that. I really think that it starts to cause disproportion to the body overall when you put too much fat in the gluteal area, and they start to just look so absurd that it's not even pretty when you see them. So I really think that if you're gonna do that, just do a little bit to enhance. Don't go ham and go crazy and get one of these huge ones that we've seen on social media. Stay tuned for the next video. She talks about other procedures that she has had, as well as the one that she's gatekeeping, and I'm gonna guess, and I think I know what it is. We'll talk about it in that video.